Excedrin Migraine is a combination of aspirin, acetaminophen, and caffeine. It is used for the temporary relief of pain from conditions such as muscle aches, toothaches, menstrual cramps, or headaches, including migraine. Aspirin and acetaminophen relieve pain by keeping your body from making certain natural substances. Caffeine helps increase the effects of aspirin and acetaminophen. It is recommended to take 2 caplets with a glass of water at the first sign of migraine symptoms. Do not take more than 2 caplets in 24 hours, unless directed by a doctor. The best time to take Excedrin Migraine is at the onset of migraine symptoms for the most effective relief. Remember, always read the directions on the package before taking Excedrin Migraine. If you have any questions, consult your pharmacist. Take it by mouth as directed by your doctor or the package directions, and make sure to drink a full glass of water with it unless your doctor tells you otherwise. If you're using the tablet form, wait at least 10 minutes before lying down. You can also take it with food or milk if it upsets your stomach. The dosage depends on your medical condition and how you respond to treatment. Don't increase your dose or use it more often or longer than directed. If you're using it as needed, take it at the first signs of pain for the best results. And if you're taking it for a headache and experience trouble speaking, weakness on one side of the body, or sudden vision changes, seek medical help right away. Also, consult a doctor or pharmacist if you have daily headaches, your first headache after age 50, a more severe headache than usual, a headache caused by head injury, coughing, or bending, or a headache with vomiting, fever, and stiff neck. And if your migraine headache isn't relieved or worsens after the first dose, talk to your doctor. Lastly, if you find yourself needing to use this medication for migraine attacks on 10 or more days each month, don't use it more often or for longer than directed. And consult your doctor if your condition lasts or gets worse. Some common side effects of Excedrin Migraine may include nausea, vomiting, stomach upset, trouble falling asleep, or feeling shaky or nervous. If these effects persist or worsen, it's important to notify your doctor or pharmacist. If your doctor has prescribed this medication, it's because they have determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. However, it's important to stop taking Excedrin Migraine and contact your doctor immediately if you experience severe stomach or abdominal pain, severe dizziness, fainting, vomit that looks like coffee grounds, black or bloody stools, ringing in the ears, loss of hearing, irregular or fast heartbeat, signs of kidney problems, or easy bruising or bleeding. While a serious allergic reaction to this drug is rare, seek medical help right away if you notice symptoms such as fever, swollen lymph nodes, rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Excedrin Migraine contains acetaminophen, which can cause liver disease if taken in large amounts. Adults should not exceed 4,000 milligrams, 4 grams, of acetaminophen per day, and those with liver problems or children should take less. It's important to check the labels of all medications you are taking to make sure they do not contain acetaminophen, and ask your pharmacist if you are unsure. If you take too much acetaminophen, seek medical help immediately, even if you feel okay. Symptoms of acetaminophen overdose include nausea, vomiting, loss of appetite, sweating, stomach pain, tiredness, yellowing of the eyes and skin, and dark urine. It's also important to avoid alcohol, as daily use combined with acetaminophen may harm your liver. Before taking Excedrin Migraine, it's important to talk to your doctor or pharmacist if you have any allergies to aspirin, other NSAIDs, salicylates, acetaminophen, or caffeine. It's also important to discuss your medical history, including asthma, blood disorders, ulcers, gout, kidney or liver disease, anxiety disorders, heart disease, high blood pressure, and stomach problems. If you are scheduled for surgery or certain medical procedures, make sure to inform your doctor about your use of this medication and any other products you may be using. This medicine may cause stomach bleeding, especially when combined with daily use of alcohol and tobacco. It's advised to avoid alcohol and stop smoking while using this medication. Older adults may be more sensitive to the side effects of Excedrin migraine, particularly stomach/intestinal bleeding and ulcers, liver problems, and trouble falling asleep. Children and teenagers under 18 years old should not use aspirin-containing or aspirin-related medications without consulting a doctor, as it may lead to a serious illness known as Reye syndrome. Women of childbearing age should discuss the benefits and risks of using Excedrin migraine with their doctor. It may harm an unborn baby and cause problems with normal labor/delivery, so it is not recommended for use in pregnancy from 20 weeks until delivery. If necessary, the lowest effective dose should be used between 20 and 30 weeks of pregnancy, and it should not be used after 30 weeks of pregnancy. This medication also passes into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Excedrin migraine, as they can affect how the medication works and increase the risk of serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Excedrin migraine include certain medications for gout, anti-seizure drugs, and certain live vaccines. It's important to consult your doctor before using Excedrin migraine if you have recently received certain live vaccines. Additionally, Excedrin migraine may increase the risk of bleeding when taken with other drugs that also may cause bleeding, such as antiplatelet drugs and blood thinners. Always check prescription and non-prescription medicine labels carefully, as many contain pain relievers that may increase your risk for side effects if taken together with Excedrin migraine. It's also important to note that Excedrin migraine may interfere with certain lab tests, potentially causing false test results. Make sure lab personnel and all your doctors know you use this drug. Remember to consult your doctor or pharmacist for more details on how to take Excedrin migraine safely. If someone has taken too much Excedrin migraine and is experiencing serious symptoms such as passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or the local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of an Excedrin migraine overdose may include nausea, vomiting, loss of appetite, sweating, burning pain in the throat and stomach, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, ringing in the ears, rapid/shallow breathing, irregular/fast heartbeat, change in the amount of urine, dark urine, confusion, agitation, seizures, or loss of consciousness. It's important not to share this medication with others. If you use Excedrin migraine regularly or at high doses, your doctor may want to schedule lab and/or medical tests to monitor your liver and kidney function. It's important to attend all scheduled medical and lab appointments. Because Excedrin migraine contains caffeine, taking it close to bedtime may make it difficult for you to fall asleep. It's best to limit the use of other caffeine-containing medications, foods, or beverages while taking this product. Consuming too much caffeine can lead to feeling nervous or irritable, having trouble sleeping, or experiencing a fast heartbeat. For those taking Excedrin migraine for headaches, it's recommended to avoid certain foods that may trigger your headaches. Making lifestyle changes, such as participating in stress reduction programs, exercising, and making dietary adjustments, may help prevent headaches. It's a good idea to talk to your doctor or pharmacist about lifestyle changes that might benefit you. If you happen to miss a dose of Excedrin migraine and you take it regularly, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose at the usual time. Don't take a double dose to make up for the missed one. It's important to store Excedrin migraine at room temperature, away from light and moisture. Be sure to keep it in a safe place, away from children and pets. When it comes to disposing of the medication, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, consult with your pharmacist or local waste disposal company to properly discard the product when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.